The National Coalition Against Domestic Violence was formed in 1978, bringing together the small number of existing local domestic violence programs. Our goal is to help other communities open shelters in their area, provide education about the issue to the general public, and to work with Congress and the White House to establish new laws and policies to address a newly identified social problem. When NCADV started, there were about 200 shelters in the country, but with our help, more than 2,000 communities have established services to assist families in crisis. NCADV is working to support advocates that are providing services to underserved populations, namely Native American women living on reservations, immigrant communities, and the LGBT community. These communities often have limited access to critical services, and NCADV was instrumental in working on legislation that expanded funding for services to these vulnerable populations. We also partner with a professional medical academy to provide cosmetic and reconstructive plastic surgery to repair damage done to the head, face, or neck as a result of an assault by an intimate partner. NCADV is the only national domestic violence organization that is directly connected to over 2,000 local service programs. Through this network, we provide an exchange of information and resources to keep them aware of trends and new research to be more effective in their crisis work. Our website provides extensive material for victims, family, and friends seeking information about domestic violence. NCADV develops partnerships with corporations and allied organizations to increase the distribution of information to large numbers of the general public. NCADV's extensive network of local programs allows us to remain up to date on the daily struggle of women and children who are victims of domestic violence. We stay informed of the obstacles that hinder the success of those seeking to leave the violence, and can use that information to develop better laws or public policy to begin reducing the blocks to their success. Issues like affordable housing, quality daycare, and access to further education for better-paying jobs all impact a victim's ability to free themselves and live safely. NCADV has a strong commitment to including the voices of survivors and developing our programs and implementing them. Survivors represent 50% of our Board of Director members, representing geographic, ethnic, and cultural diversity. We survey the programs with questions on how the laws created to address this issue are working at the local level, or how a downturn in the economy is impacting their ability to provide services. We review those responses and serve them with pivotal agencies and leaders to begin correcting problems that are identified. Many people may think that advocates working to end domestic violence are working against men. To the contrary, NCADV has been working diligently in recent years to build alliances with men who support an end to violence against women. Men are critical to the long-term success of reducing violence in the home, and inviting them to join us in this effort is an important step to changing the social norm that currently exists. NCADV is seen as a critical leader on public policy issues in Washington, D.C. We were instrumental to the passage of the Violence Against Women Act in 1994 and the subsequent reauthorizations. This bill provides extensive funding for education of law enforcement, judges, and attorneys. It also provides funding for the National Hotline, local crisis services, and technical assistance and training for advocates. While much progress has been made to reduce domestic violence, there still is a persistent attitude in the general public that victims are somehow responsible for the violence perpetrated against them. The constantly framed question, "Why doesn't she just leave?" indicates that mass education is still needed. There is much work remaining to inform people of the difficulty every victim has in taking that first step to leave, and the ongoing actions of violence and threats the abuser uses to make sure she fails if she does make that decision. NCADV has created several educational materials and seminars to address issues facing battered women, such as establishing or regaining financial stability, educating teachers on signs to recognize children at risk of abuse and what resources exist in their area that offer assistance to families in need. Funding for these programs has ended, but based on feedback, we know that these topics and materials are still important ones. We hope to expand our technology capacity to provide much of the education and material through web-based learning sessions. This will increase the number of people who can gain access to the information while saving limited resources for direct service needs. Research shows that long-term chronic health issues are created by the trauma of living in a violent home. We want to expand our program to assist victims to include a more holistic approach to recovery. Educating advocates and victims about the long-term impact and how to manage those issues are important as they work to stabilize their lives.